Welcome, Joan. I am speaking today with Joan Bretthauer, who is an advanced illness doula. She was our special guest at a recent Spotlight on Seniors segment on our ballroom lecture series. So for those of you who are able to join in person, this will be a bit of hearing some of the same information again. And those who are not able to join us, I hope this will give you a taste of what we talked about there. Joan, thank you so much for taking the time today.
Thank you for having me. I
Well,
appreciate it.
absolutely. Now, tell me a little bit about what it means to say that you are an advanced illness doula.
Back in 2017, 2018, I did training in end of life care. And so I, being an advanced illness doula, work with clients from a terminal diagnosis all the way through the end of life.
Mm.
And I work with the family a little bit after that. And what I do is I companion people through the illness. I'm their advocate. I'm there for them and for their family. So
Wonderful.
it's very humbling. It's very interesting. You get a lot of family dynamics and stuff, but it's well worth it. It's well worth it.
How did you become interested in this line of work?
Well, I have always been interested in end of life care. My dad was on hospice back in 2012, and
Mm.
that was the first time that I had heard of hospice. And shortly after that, probably about 4 years after that, I became a hospice volunteer. And I am still a hospice volunteer. And it's a wonderful experience, and it's wonderful to be with people at that time. So, and that's actually from my experience of hospice is what got me into advanced care planning. And what I did was, once I became a hospice volunteer, I started going to events that Gateway End of Life Coalition was putting on. Gateway has been around in the community for about 20, 25 years, and it's comprised of hospice companies, palliative care, not really the companies, employees.
Mm.
So, Gateway End of Life Coalition has events around the community that deal with hospice, palliative care, grief, anything in that arena. And we have a lot of social workers, some nurses, a few physicians that actually attend the events. And anyway, so I was on Gateway's board for a long time. And by being on the board, advanced care planning came up quite a bit. And every year there's National Healthcare's Decision Day, which is a day to complete your advance directive, and that's in April. It always
Oh.
comes April 16th, a few days after, or the day after taxes are due. Yeah, nationally, it's been around a long time. But anyway, Gateway and participating in National Healthcare's Decisions Day and how important it is. Then through Gateway, the at the time, the vice president and I put together a program to go out into the community to do advanced care planning and to have teach people how to have the conversation to complete their advance directive. And so we've done, there's an organization called the Conversation Project, conversationproject.org, that has a lot of information on their website about how to have an end of life conversation, how to start an end of life conversation. Because a lot of people don't know where to start.
Sure.
And it can be an easy process, it can be scary, but knowing, and for me, the reason why I do, and I'm so committed to people completing their advance directive is because I want people to be empowered with their health care. No matter what your background is, who you are in the community, anything like that. I want you to be empowered. And advanced care planning, your advance directive does not go into effect. The only time it goes into effect is when you cannot speak for yourself.
Right.
Otherwise, you have total control.
Right.
So it's really important to me that people have completed an advance directive and they know what to do with it. And they know once they do it, that's not the end. You still have conversations around what kind of care you want or don't want.
Mm-hmm.
So because in a medical crisis, it's really important that healthcare professionals know.
Absolutely. So what are
Yes.
some of the common questions that people have about advanced care directives?
Well, there's fear. Um, Even though you complete an advance directive, does not mean it's cut in stone.
Right,
It's a guide for
right.
when you can't speak for yourself, that your power of attorney for healthcare can speak for you because they know what kind of care you want. One thing is that I think, personally, I think that people are afraid to complete their directive is because there are so many different healthcare directives out there.
Sure.
If you go to AARP and you click on your healthcare directive for your state, you get a healthcare directive.
Hmm.
If you go to the Missouri Hospice and Palliative Care or the National Hospice and Palliative Care website, and it says click on your state for a directive, you get a different kind of a directive, but they're both legal directives.
Oh,
And then,
interesting.
of course, yep, we have the Missouri Bar, which has an advance directive, and then we have Five Wishes. So there are, and then luckily in Kansas City, we have the bioethical group, which has their own directive. So
Mm,
there are many different types of directives, but every directive has two parts to it. And this is the durable power of attorney for healthcare from the Missouri Bar. Okay, every directive has two parts. One is choosing who your power of attorney for healthcare will be, and the other part is your actual healthcare directive. So each one has two parts. You choose who your power of attorney for healthcare is, and then you complete the form. What makes it legal in Missouri, you have to have it notarized and two witnesses.
mm,
So, what is legal about it is the durable power of attorney for healthcare. Whoever you choose for that, by having your information notarized and having two witnesses, that is what makes it legal. And the other thing is, and I did not know all of this until I started doing the research several years ago when I started doing the presentations. Now, this one is Five Wishes. This one is my favorite because this one is subjective. And this one, wish number one, is choosing your healthcare agent.
mhm.
Now, every directive calls that title of that person something different. So that can be confusing. So, with all the directives that I have found, there are several different names for the same person. And I think people get confused by that. And sometimes when you read the instructions, like of the Missouri Bar one, there's so much information in there, unless you're familiar with it.
Yeah,
I mean, it can be a burdensome to read all the directions and then try to understand it when
right,
you can talk to someone who can help you put it together. So, yes. And
got it.
then we also have attorneys call it a living will, your healthcare living will. And I think that can kind of confuse people sometime because they think they have to go to an attorney to complete their healthcare directive, which
Mm,
they don't.
mhm.
The attorney does the living will. Yes, you want to see an attorney for your finances, but we're not talking about finances. We're
Right.
specifically talking about a healthcare directive. So, but I think people have fear because they get a directive and they don't know where to start. So it's not just having fear of the conversation. It's like, oh my gosh, I don't know how to start the conversation. I don't know how to complete this booklet. So,
Mhm.
and I think that they think that whatever they put in that booklet is cut in stone, and it's not.
Right.
The most important part is having conversations with your family for what you want or you don't want. So, and then getting those in writing is important. Getting it notarized is important. And then sharing it with your doctor,
Mhm.
that's very important. Giving a copy to your doctor, giving a copy to your healthcare power of attorney. Your healthcare information with your healthcare, you want to share with everyone for what you want or don't want when you cannot make decisions on your own. And I think there are so many myths about advanced care planning and completing a healthcare directive that, and then of course people think it's never going to happen to me.
Sure.
Of course I'll always be prepared, but you just never know.
What are
You
some
just
of the
never.
myths out there?
Well, one is that people think that healthcare directives is only for old people.
Sure.
And that's not true. Really, anyone 18 years and over should have a healthcare directive. If they don't have a healthcare directive, especially if you're 18 or 19, your parents need to know what kind of care you want. And it is interesting because through the Conversation Project, they have a video on their website of a family having a conversation and how that conversation went, and how the young son, I think he was in his 20s, was telling his family after engaging in this conversation that what he wanted and didn't want. And to know at that age, well, first of all, no one really wants to be a burden. That's one thing I always hear. I don't want to be a burden on my family, and I don't want them having to take care of me, and I don't want, and it's like, okay, well, let's talk about it and let's put that in your directive. So the conversation is the most important that you have with your family about the kind of care you want or don't want.
Mhm,
And your
mhm.
end of life could be at any time. I mean, you could be in an accident, you could there's just so many variables,
Yeah.
and you cannot cover everything in an advance directive. That's why having the conversations with your loved ones is so, so important.
And I
So,
noticed you just said conversations. You recommend that people do this more than once.
right. So once you complete a healthcare directive, they say that you should visit that directive every 5 years, meaning update it. Or if you have a healthcare issue or crisis, you need to update your advance directive. Or if you get divorced, there are reasons why you want to keep your healthcare advance directive updated. And how do you do that? You fill out a new form and you throw away the old form. So it's very simple. It's I think it's easier than what people think. But again, it can be challenging when you don't know. I mean, I think in my 40s when I finally did my directive.
Right.
So, and the only reason I did it was because of being on Gateway's board and hearing all the healthcare providers talking about advanced care planning.
Sure.
So, anyway, yeah.
So, I would imagine that another mitigating factor is the different changes that can happen in the medical field because of all of the advances of care that happen.
Yes. And what you want to know is when you go to the emergency room, they are going to do everything they can to keep you alive. Everything. And if you're old and frail, or even if you're young and frail and you have a terminal illness, the hospital staff really needs to know what kind of care you want. It is so vital then. And there's research that shows that families that don't know what their loved ones want or that don't complete a healthcare directive in a crisis, it can cause a lot of trouble.
Mm,
I mean, the guilt when you have to make a decision. What I like about completing a healthcare directive is that your power of attorney is going to go by what you want. And when you complete a directive, you complete it for what you want, not what your kids want, how they want your healthcare to be, not how your spouse or your significant other wants your healthcare to be, but by what you want. And that's why it's so important to let your family know what you want. Because if someone doesn't agree with what you want, then you can have a conversation with them. But still, it's what you want. And that's what your power of attorney for healthcare should follow through with what you want, what you have in the document, or what you have spoken to them about.
that,
So, if
yeah.
it, yeah, in the crisis is when it gets really crazy. So, anything you can prepare ahead of time before a crisis, I hope a crisis doesn't happen,
Mhm.
but it does happen. And so you just want to be prepared.
That
And I
was definitely something that stood out to me in your presentation here at College Church. That I think the way you put it was that sometimes people shy away from saying, "Oh, I don't want to have that responsibility of being the medical power of attorney because I don't want to make that decision." And you stressed it's not their decision; it's this decision of the person who is undergoing the health crisis, and they are just the ones that are making sure that that decision is being communicated.
right, right, exactly. You were listening. Very
I was
good.
listening.
It's a conversation to have. And it can be scary, like I said earlier, everything can be scary, but that's why you have professionals to help you. And actually, you could go to your doctor and complete your advance directive with him or her,
Right,
whoever your doctor is.
right.
And Medicare will pay for that conversation.
Oh, wow, okay.
So, yeah, and there's that's been probably maybe 5 years. I'm kind of guessing.
Mhm.
So for about the last 5 years, Medicare approved to have advanced care planning conversations with your doctor.
Oh, that's very
So
helpful. And I also remember you saying something about where in the home people should have that.
yes, do not put it in your safe.
Mhm.
You want it accessible. I know someone at the event was talking about how, and I forget the person's name, but anyway, they were talking about how their friend kept their advance directive in their purse,
Mm,
which is really a good idea
sure.
to have it there. And so you don't want it hidden. It's information that you want shared with those you feel comfortable with, those who are in charge of your healthcare. And you definitely, like I had said a few minutes ago, want to share it with your doctor, with the hospital that you go to, and stuff like that. So, yeah, this is not information to keep quiet about.
Right.
So, and some people, the older people, will actually have their healthcare directive that's close by, sometimes in the kitchen.
Mhm.
And we did talk about the out of hospital do not resuscitate form.
Mm,
And that's ordered by a physician. So there are other documents when you're terminally ill. There are other documents besides your healthcare directive, your advance directive that you want to complete. And
mhm.
those documents are given to you by your physician that have to be signed by a physician.
Got it.
Okay. So, yes. But as far as where do you keep your healthcare directive, keep it somewhere where you can find it because you never know when you're going to need it. And if it's on file at the hospital you go to or with your physician, they're going to know because it's on file. And that's a very important part of the process is making sure they have a copy.
That's super helpful. Joan, thank you for the time today. Really appreciate it.
You are more than welcome. Anytime you want to talk about advanced care planning, having the conversation, how to start the conversation,
I
I would
can,
love to, yeah,
yeah.
help anyone.
Okay, I will
So,
make sure that your contact information is in with this video too, so that people know how to reach you.
excellent. Thank you so much, Angela. I appreciate your time.
Thank you.
Uh-huh. Bye-bye.